Hey everybody, I'm Aditya Bansal and welcome to Digital Health on Air. I'm joined by Ajay Kapare, President and CEO of ELLKAY. We're super lucky to have Ajay with us here at this time of exciting growth for ELLKAY. If you've been at any of the healthcare shows in the last 5 years, you've definitely seen ELLKAY. They do a phenomenal job of showing up big and showing what they're all about. Today, we're going to discuss a little bit about interop and healthcare and how those things play together. Ajay, welcome to the show.
Thank you so much. And you talked about LK and conferences. And, I just want to remind everyone that I actually bumped into Aditya at a conference. And post that, they have been a great partners and he's been a great friend from time to time. Aditya and his other co-founders and teammates, whenever I meet them, I've always enjoyed talking and learning from them.
I really joke and I poke fun a lot of Ajay and the ELLKAY folks that if you ever want your selfie taken, these are the guys to take it. They're pros at it. So Ajay, you were recently promoted to CEO, so well deserved. Your leadership in healthcare, both at ELLKAY and kind of on the Chime board, I think you're well recognized as a leader. So give us a little bit of an insight into your journey into this role into ELLKAY. What brought you into the organization, and kind of what are you focused now in your new role as a CEO?
Yeah, a lot of people don't know. I was friends with LK, but I was also a customer of LK.
Oh, really? I was among the people who didn't know that.
Yeah, I was a customer of LK in my previous life. And then, we became friends and I knew about it, started more like an advisor. And, I really like the people, the culture, the products, and what we can do with that. And it's almost now 7.5 years for me. And when I joined back in 2017, and time has gone or flown very fast. And for both of our founders, Kamal and Lior, what they did with the business, and then all of us together, how we are growing the business, it has been an incredible journey. And in my recent role, I was president and chief strategy officer, where a portion of strategy, marketing, sales, I was a responsible portion of operation, but also working across with everyone. And
Sure.
really excited to take CEO as a next thing, and very appreciative of all my people and the customers and partners with who we work with.
So I think for a lot of our audience and the digital health on air audience, we see ELLKAY, we hear of ELLKAY, but we may not necessarily know what is ELLKAY. Just tell us a little bit more around, the products, solutions, the customers, like a little bit more about in a nutshell, what does ELLKAY do?
LK as a company, we are an enterprise interoperability solution provider company. And we're in 5 segments of healthcare: ambulatory, where we do data migration, conversion; clinical and archive, or 22,000 physician offices, users. We have worked with 200 different EMR, 1,200 different versions. Yes, there are that many EMR, small, big, medium. Then on the hospital side, we decommission old legacy application. Anyone actually changing their EMR, we archive that. We also provide our LK Opera solution of interoperability in the hospital space. Then we are also in the clinical labs, so 600 clinical labs as a customer, where we primarily do LIS to EMR integration, order and result portal. LK Orbit is a solution. And during COVID, we did a phenomenal amount of work, over 80 million transactions during COVID. That's the COVID platform that we came with. And we feel like we played a bigger role in humanity and in playing a role of saving lives. And we all are in the business of saving lives in one way or another. Our 4th segment is, we do interoperability for other vendors, where we have partners like you guys. We work innovative partners on the interop and connectivity. And then also in the payer side, where we are providing clinical data exchange. We're doing a lot of interop work on the payer space, which is upcoming and fast growing segment. And
Imagine.
slowly getting towards data and life science. But as a company, we are at a journey with all the interoperability that we are doing. Commonwealth is another one whose platform is on LK. And we are slowly moving towards becoming an enterprise data management company. And we're very excited with this journey.
So you're really articulating that the core, raison d'etre, the why you exist is around healthcare interoperability. And I think, I'd be curious to get your take on interoperability drives growth, right? It's actually a net positive for everybody. But how do you see interoperability driving growth, not just in your business, because it's the business of ELLKAY, but also healthcare is writ large. How do you see healthcare interoperability driving that?
So I think, if you look at solutions like, innovative solutions which are coming out, whether AI, ML, or, even like, well, nowadays, if you don't talk about AI, you're like, you're missing.
Your 2022's company, right?
Exactly, right.
Yeah.
And look at your company too. What we are trying to do is, see, interoperability is a play, but the core business that companies like you have, or health system, clinical lab, payers, they need to focus on the core solution, and we are the back-end interoperability experts for them. I don't think without interoperability, you can actually achieve anything. You can have the best applications out there, but if you don't have the right data connected with the right access, and if you are not giving the quality data, you can't actually apply your algorithms on top of it and get the result that you're looking for. Why interoperability plays a big role? Because, if you have garbage in and garbage out, then what?
You have garbage care. Yeah.
It is not going to work. And, we will all be actually having all these applications, all these great products. And then, you will not going to see the ROI. You're not going to see the end result. And at the end of the day, the healthcare cost or the healthcare IT cost is going to increase. So I feel like we play an extremely important role where get the right data, connect the right dots, and make sure that the products can talk with each other and also get the result that the health system or anyone who's choosing these applications.
Yeah, interop is this kind of complex and esoteric area of healthcare, but I sort of feel like in 24 with TEFCA coming, and work that you guys are doing with Commonwealth, 2025 is a very different year for interoperability, both in terms of how people talk about it, but also in terms of what it means and kind of like the promise, and the promise actually becoming a reality, right? Not just like words we say. So can you tell me a little bit more about in 2025, like what are you seeing in terms of interop that might have been different than the last couple of years?
Yeah, I think, and I'll put it into like two-part answer. One of the answer is that, see, our commitment toward interoperability, it can super easily demonstrated by the supporting work that we're doing with Commonwealth. We're becoming Commonwealth becoming the QHIN under TEFCA, as well as the vast partnership with EMR system to support seamless integration, leveraging the FHIR and other standards. That's one side of it.
Sure.
The second side is, if you really look at it, is that, we are talking about so much AI, ML, clinical life sciences, pharma, all the pieces which are coming in. And there is so much growth, but this growth without the focus on proper interoperability, proper data management, quality and exchange is absolutely nowhere. So we are super excited with the year. We feel like the quality data, the AI stats, and the ends with the data that is being fed into the algorithm, we are going to play a very tremendous and a big role in this. And super excited with that. And we're looking for more strategic partners who can actually join us with this journey.
So I'll take the bait here on the AI question, because like you said, every conversation has a little flavor of AI to it. AI's data and interoperable data, and to your point, not garbage data, is critical for successful consumption of AI models, ML models, things like that. Are you seeing a demand kind of, or a change in the way that health systems and IT vendors and ML makers are talking about the quality of the data now?
So think about it. If you ask 10 health system what is their strategy with this AI application and how they're going to use it, chances are you're going to get actually 10 different answers.
Yeah, maybe more. Yeah.
Right. I think, but one common theme stays is the quality of data, getting the right feeds, putting the right data into the algorithm, making sure that, we are absolutely doing the right things in order for those applications to work. That is the core fundamental thing. And I feel like for us, why we are super excited is because there are going to be more complexities, but a company like ELLKAY, we are on 65,000 interfaces up and live. In one way or another,
fairly big number.
And in one way or another, we have, with our work with Commonwealth, with our work with number of health system that we have over 300 health system with who we work with. We have such a huge amount of data and huge amount of transactions which happen every day. We feel like we are putting so much core on how we can actually change. What are some of the things we need to get ready? We are working with so many partners out there in the industry, so many, not only EMR partners, but also a lot of AI partners, a lot of companies like you guys.
Of course, yeah.
I feel like the standards are changing. There are some regulations, we are looking at it. But I feel like we are very equipped and we are very very core to our function, where we feel like we are at the edge. We are not just actually adding another pipe, but we are adding meaningful data.
Yeah.
That is going to be the thing that is going to be changed. It's not just connectivity, but it is also like, getting the right data at the right time, so that the right access to those algorithms of the AI, they can actually take their function, they can do their function and get the result that everyone is looking at.
So future cast for me here a little bit. Let's go out 3 years, 4 years, 2 years, whatever the number you want to pick is, where, we have this web of connected health systems, lab partners, digital health vendors, and that sort of stuff. This piping is critical, right? And it's like you said, I think we're evolving past the point of, to use a terminology from maybe telephony, we're past the part of dumb pipes, right? We want to have actually a lot of smarts and routing and intelligence and data extraction, data validation. Where do you see some of that sort of stuff future casted? Like, is that going to be the role of, organizations such as yourselves? Is it going to be the EMRs? Is it going to be the lab partners? Like, who plays the biggest role as this market evolves?
As I said, I think, see, at the end of the day, everyone is going to focus on their core solution and core offering.
Yep.
And the interoperability play is going to be humongous. I mean, you cannot, look at your company also. You cannot do anything without a problem.
Without some data. Yep.
Right. Without the data, without the connectivity, without the
completely agree.
Providing. I think LK, we are at a core junction of where we are actually playing that leadership role, where we're looking at in next 3 to 5 years, how we are actually playing ourselves to become that enterprise data management company. This network of network which is out there, we have Commonwealth, we have our lab side, we have our hospital side, we have our, ambulatory side. We also have the work that we do with different, healthcare IT vendors like you guys.
Yep.
But the payer side, the data and life science side, I think we are going to become that engine, a powerful engine of all these network of networks, which is going to take our make our vision to become that enterprise data management company a reality, and will play a humongous role. But we'll also cut down a lot of cost. We'll also cut down a lot of, wastage which happens out there. I mean, think about it. If there are two organizations which are across the road with each other, or two healthcare IT vendors which are across each other, if everyone start developing the same thing, doing the testing with the same thing, is the amount of wastage.
Yeah.
Out there. And then there are companies like us, which we are developing our core competency, and we're trying to reutilize it in many ways. So we are very excited with that.
Let's talk about that concept there for a quick second. So I think it's really interesting around it from an industry perspective. There are many organizations who are trying to solve similar problems. Many organizations which are solving, either competing with the health system down the street or the lab vendor down the street. They're solving a problem in a very, very similar way. And to use your words, there's wastage happening, right? Whether it's duplicated efforts or duplicated products being created. Can you talk a little bit to me about like how you, Ajay, like a well-seasoned healthcare IT executive, like how do you see the industry trying to solve that to reduce costs overall to delivery of care?
I think we'll need a bigger discussion on that for sure. But
how much time do you got, right?
Yeah, I mean, we'll need there will be a lot of conversation, a lot of discussion. It needs to happen. But, I think where we are coming from, when we talk about being that core enterprise interop company, solution company, and where we are going towards enterprise data management company, there are still pieces in between. Interface management is another one. We have solved that problem in certain areas of the business, and we are trying to solve it slowly. We are trying to solve it in different areas of the business. But we are on the path of making all those things a reality. And anyone who's partnering with us, we are taking the biggest thing, I'll tell you, Aditya, in this industry, which I have learned and observed, is listening. Listening is one of the things. It's an art. When you listen to your customer, when you listen to the industry, when you listen to the leaders, we have done that here at LK, and we have made changes. We have actually looked at our product. We have looked at our roadmap. We have put all the right things in the mix, which is going to get us actually equipped with being successful for the next few years. And we are on the path of doing the same thing, how we can actually, avoid these wastage. You are right track. And a lot of that you will see coming from LK in next few months and few years. But the ultimate goal is the patient. We are all in this business of
In service of the patient. Yes.
yeah, we are in one way or another. I joined healthcare and I stayed in healthcare ITs because I'm very passionate about what we all can, when we all can come together, what can we do at the end of the day, how we can actually help to make a patient better and safer. And if that also means that there is a wastage that we can utilize, if we can actually get the right access, right data at the right point, we are absolutely committed to that. So, and I'm
Yeah.
looking forward to it.
Yeah, and I think like you're getting the right data to the right patient or to the right provider or scenario at the right time. Ultimately, that helps outcomes, right? It helps providers provide better care, pay or reimburse more appropriately. All the life sciences perform better trials, all that sort of stuff. So maybe let's let's change directions a little bit, because one of the things that you and I have spent some time talking about in the past is kind of the ascendancy of value-based care. And I feel like Interop plays such a big part in how the delivery of value-based care happens. Because I, as a patient, may have a provider who I have a capitative model with, but at the end of the day, I still may see somebody else who's outside my value-based ecosystem, right, or my capitative model. Interop to me would have to play a big part in providing the whole patient view to reduce that wastage along the way. Like, what are you seeing in the industry? What are you seeing at industry events around like Interop being actually maybe the secret sauce to make value-based care happen?
If you look at it, there is so much that interoperability can do to support value-based care arrangement. Take our work with any large clinically integrated network. What we do is we support full data aggregation of clinical data, emphasize on the clinical data and not just claims data. We support these organizations to, unify the patient data across the spectrum of acute as well as ambulatory locations in the community.
So yes, I think that's one of those really important parts, is not just in the IDN, but in the community as well.
And, those connect the dots because the gaps are missing in these patients' treatment, and when you consolidate all this patient data across a community, it creates a longitudinal view to truly understand, hey, what is missing? What are we doing too much of? And how can we support the population of our communities? And if you look at what value-based care arrangement can support is valuable insight on gap in care, risk assessment, and utilization management effort. So we're working with numerous organizations on how we can translate these findings or gaps directly back into their EHR system so that, it can be seen with a clinician workflow and simultaneously acted upon. I think the main thing is, acting upon. And like you can act upon only when you get the right data, I feel like.
Yeah, I mean, I've spent a lot of time talking to community-based hospitals, smaller hospitals, and really one of the main things that they struggle with is, how do I see the rest of the care that the patients had when they come into care at my site? And I think one of the powerful stories there, like that we have to as an industry continue to move forward on, is actually providing that clinically integrated view, not only for the moment at time of service, but also for identifying gaps in care, underutilization of resources, and all the other parts that you'd mentioned there. I hear it every day talking to healthcare providers who are in rural or even smaller community-based care settings.
And so that is the work we all have to do. We cannot forget the community hospital, the rural health, and those are a very important part of our ecosystem.
Yes, and they provide a massive amount of the care. And also, that's in the world of acute care, but also FQHCs and ambulatory care. Like, this catchment is critical to care delivery. So Jake, go back to a thought we had a minute ago, which is, future cast for me a little bit, like challenges, opportunities that you see in the healthcare ecosystem, 2025, 2026. If we're doing this in January, we said, tell me your prediction for 2025, but I want the bigger picture. You're a big healthcare thinker. What are you thinking about right now?
I always believe in, things that are in your hand, do it honestly, sincerely. There is a lot of noise out there. When you go to any conference, I think there are definitely great innovation, great energy, great things happening around. But at the same time, there is a lot of noise also, right? So what should I do? What should I not do? Don't get overwhelmed with that. I personally feel that, you got to keep your head down and focus on the things and the areas that you're good at and keep doing it. And excellence will happen in that and the results will come. It doesn't happen over time. You got to keep patience. which, I've learned over the number of years. You got to keep patience. You got to actually listening to your customer, listening to your own team, listening to the industry is extremely important. But a very big part is listening to who.
Yeah, interesting. Okay.
Not to listen to. I feel like it is extremely important. And then, getting together with the team and making sure that, we are going to have great months, great quarters, and not so great months and not so great quarters. And it's okay. Those not so great months or great quarters is the time where you just look at it, make some adjustment. I always feel like I say that a lot of time we are in the era of Moneyball in healthcare, where you don't have to win every time by hitting home runs. Even a singles can actually win you the game. So look at those singles. Sometimes
look at the trend line, right? The trend line takes you there.
We ignore the singles, and we don't look at them, and we should look at them more and look at what else can we do. Are there going to be problems? Yes, there are going to be problems, but the more the problems are, the more opportunities are also there. I always feel like either you're a problem or you're a solution. So you got to find that solution as a team, as an individual, as a company, and look at that and try to get the best out of it.
I love that. Ajay, words of wisdom from Ajay, CEO of ELLKAY. Really great spending some time talking to you. And I think your words around like active listening and listening to whom is great advice for both not just healthcare entrepreneurs, but healthcare executives who work in health systems, life science, payer, and across the entire healthcare delivery ecosystem. Ajay, again, thank you so much for your time, your insights on how interoperability is the backbone to what makes great care happen. I think are lessons that all of us can take and learn something from. Thank you so much for spending your time with me today.
Thank you for the opportunity. And, as I said, I always enjoy talking to you. I feel re-energized and I feel like I need to do more.
I feel the same way talking to you. Have a good one.
Yeah. Thank you, Aditya.